name is Mari Garcia, and today I'm gonna show you the procedure about the skin test or IG. But first thing we have to do is to check the doctor's order, check the medication administration record, check the label of the medication carefully to make sure that the correct medication being prepared. Do the three steps of the checking. First is read the label of the medication. Second one is when it is taken from the medication. And the third one, before and after withdrawing the medication. Those are very important. Organize all the equipment needed. I have here a 1 cc syringe, and I got a vial, which is with the medication. I also had 2 pieces of antiseptic, and also the cotton balls if I need it. If necessary, then I gotta use it. Then I got 2 gloves, a pair of gloves, and also I have my alcohol and hand hygiene. And followed by my notebook to write it down, all the notes later on with my black ball pen or pen. Now I'm going to perform my hand hygiene by simply washing my hands to avoid cross-contamination. I have medication and 1 syringe ready. Take note, if you're mixing a meds from the vial, you don't have to shake it. Instead, use both palms of your hands and also by rotating it, just like this. Now, remove the cap of or clean with the antiseptic solution circulate with circular motion. If the medicine have been previously open, like right now, mine is previously open. So what should I do is I'm gonna clean on it with from circular motion from inside goes outside. And then I'm going to withdraw the medicine by inserting the air of the vial to the desired amount of medication that I'm going to take out from the vial. So I will insert a 0.05 cc of air because that's the amount of the medicine I'm going to take out from the vial. Take note, we don't have to put all the needles inside the vial, but you have to ensure that the tip of the needle is below to the fluid level and then gradually withdraw with the medication. So I'm gonna put a 0.5 cc of air on my vial. And then release it. And then take this out. And then I'm gonna insert it back. And I turn it upside down. As you can see, I did not put all the needle on the inside of my vial, but I reassured that the needles I had is right on it's not on top of the medicine. So I will take out a 5 cc of the medication. To make so if you want to be like really easy for you, just like make it sure or just to do thing like face the number to be easily that you're in the right number or the right dosage. Now I got my medication here, and I'm gonna put it back on my tray with my cap, but don't recap the syringe with your two hands. Just one hand, like fishing type thing. Okay. Now I'm going to face the patient and explain all the procedure that I'm going to do it for her. Okay. Good morning, ma'am. My name is Mari Garcia, your student nurse for today. And today we're going to have a skin test. We did this skin test, ma'am, to assure that you don't have any allergy of the medication that we're going to give it to you later on. But I'm gonna hold your hand and then in your forearm, and then you will feel the prick of the needle, and then I'm gonna make a wheel, and we call that bulb. And also to assure that you don't have any allergies. Is that alright with you, ma'am? Alright, thank you, ma'am. So now that I'm done explaining to my patient, take note, avoid using the part of that had a lesion, tenderness, or swollen to see a better result. Because like for example, if you use the part that have lesion, then you cannot see if she has any allergy reaction, or it's already bulging, or if it's already had redness. Then you don't have to, you cannot see the result properly, and then that's gonna be a kind of question for us medical. Now I'm going to wear my gloves as an agency policy and clean the area which is the forearm with the circular motion. Oh, ma'am, is it okay to you that I'm gonna close the door for your own privacy, and also so nobody could distract us while we're doing the procedure. Okay, ma'am. Thank you. Now that I had my gloves on, I'm ready to do the procedure to my client or to my patient. First is I'm going to get a new antiseptic to clean up his arm where I'm going to do the procedure. And remember, you have to do the circular motion, which is from inside goes outside. So I got tomato here. I'm gonna use this as his skin. From inside goes outside, and then discharge. So now that I am done cleaning it, while waiting to dry that antiseptic solution, I'm going to remove the cap of my syringe and expel any bubbles from the syringe. Small bubbles because that adhere the plunger are no consequences. So I'm recapping it right now, and I just reassured that there is no bubbles on the syringe. Okay. Now I'm going to grasp the syringe with the dominant hand, which is this is my dominant hand, and also with the bevel up. Position the needle on skin with almost parallel position to 10 to 15 degree, which is like this. Bevel up, and then you're gonna grasp the skin like this, like either. Just imagine it that this is the arm of my client, and I'm gonna grasp like this or like this, or you could do like this, and then I'm gonna rest assured that the bevel is up. And then in the 10 to 15 degree, you could do that by inserting it. Okay? After that, if you had like any exist, you don't take note. We don't have to rub the part that we already injected. If there's something like leakage or just a little thing like watery, all you have to do is to tap it with a cotton, but not massage it. Because massaging it makes it like there is possible that it will get red. And then what we're trying to do here is test that we're testing an allergy which is not supposed to be red. And then if you're going to take this off, like for example, this is already inserted here. You cannot like dislocate it or like doing like this or reposition the syringe. You have to pull out really slow with the same angle and the same position. So after that, now that I am done with the procedure with my patient, I will remove my gloves and discharge it properly. I'll perform my hand hygiene and encircle the injection site with the black pen. I remove my gloves and discharge it properly. And then I'm gonna apply my alcohol. And then I'm going to get a pen and I'm going to encircle that on where I was testing. Like for example, this is my arm. And I took the test here, but then I had to encircle right where the wheels happen. Okay, do not encircle it widely. You have to encircle right on the wheels. Another thing, we cannot use a red pen for some reason. If we use a red pen, but then if the red ink will scattered, it will go like this. It will look like this, but then it will red all over. But then you cannot figure out if she's having an allergy reaction. And then now I'm going to document all the relevant information. Will evaluate and condition in 30 minutes. So anything that an unusual change, I will report it. So don't forget to say thank you and appreciate the client. Thank you, ma'am. We're done your skin test, and I will be back later in 30 minutes. Do you have any question or any clarification regarding to that procedure that we have done? When the client say no, then again, thank you, ma'am. I'm very appreciated, and I will see you around or see you in 30 minutes. And that's it for today's video. Thank you for watching.